Good morning, good afternoon, and good evening. Welcome to the 560th day of continuous Zoom session of IFPH. So, on our guest is Dr. Hubert De Silva, MSc BHMS, and the topic is Management of Endocrine Disorders, Part 2.
Happy are those who work for peace. God will call them his children. Our duty is that. Physicians' only high and only mission is to make the sick to health. Sick persons are everywhere. Sick society is everywhere. But we have the duty to clear it. Wherever there is problem, then we have to make clear. Each individual should be clean. Then only the whole world will be clean. So there are so many things. Last time I taught the things of our pituitary gland. Each and every person having the pituitary gland. Even the richest man in the world and the poorest man in the world have pituitary gland. The richest person have blood, and the poorest also have blood. And sometimes they are much good and healthy pituitary gland than the rich person. That is what we can see in whenever there are so many gypsies are in our world. They are wandering here and there, but they have very good health. The atmosphere will not affect them. Why? They can overcome the problems of the atmosphere and the ecology. But we are not, we are living inside the homes and our immunity power lost. I heard that Rabindranath Tagore, who was always lie outside his garden. In the morning, his body full of mist and then he will throw it off and he will rise from his bed from outside. So let us go back to natural way of living. Now, the previous time, I have taught about our pituitary gland, the smallest gland, and gone through every some part of it. And today we are going to the rest of the part. Last time I just went through these medicines which are affected with, we can make more things. These are the medicines, homeopathic medicines are effective for pituitary gland problems. Varieta carb, Varieta fos, Silesia, Puja, Calcarea fos, Natramur, Calcare carb. These are the basic medicines we can use wherever there is any problem in the pituitary gland. Then other symptomatology can be do after it. We just know, all of you know that these are the problems. Main problems are causing whenever there is any pituitary disorders. First, acromegaly, craniopharyngioma, Cushing's syndrome, growth hormone deficiency, non-functioning pituitary adenoma, prolactinomia, Rathke's cleft cyst. These are the important things. Then we are going most of the important things. Let us go through this pituitary gland. Where it is? It is inside the brain, below the cerebrum, and anterior. The gland is mainly three parts: anterior pituitary, posterior pituitary, and the middle part. From here, it controls the whole body. The smallest, where we can see that it is like a pear, that much small, but it affects the whole body. I told you that these are the main problems. Then we can say whenever there is problems, then we have to, how can I increase my growth hormone? Lose body weight, body fat, fast intermittently, reduce your sugar intake, don't eat a lot before bedtime, exercise at a high intensity, take a spot ring around your workouts. These are the main things. Just we can do whenever there is problem for pituitary gland for formation, that is in the adolescent period for to get growth hormone. There is a problem that if the child is the boy is small, then we have to do these are the things we just do. Loss body weight, fast intermittently. Fasting is good. Reduce your sugar intake. Don't eat a lot before bedtime. Exercise at high intensity. Take a sports drink around your workouts. Now, let us go to pituitary. What are the symptoms of pituitary gland problems? We may be misled by many things. But first, we should give importance to the pituitary problems. What are the pituitary problems? Then we should know how it affects the whole body. The general symptoms, we know that homeopathy have general symptoms, particular symptoms, and all. The generalities are coming under this. Let us see one by one. Signs and symptoms of pituitary disorder: anxiety or depression, diabetes, hair loss, high blood pressure, irregular menstrual periods, unexpected breast milk production, low energy or low sex drive, standard growth or unusual growth spurts. These are the main symptoms we can see in pituitary hormonal disorders. We may think that these symptoms are also with a thyroid problem. We may also think that these are the problems attaching with the adrenal problem. There are so many symptoms are seeing each and every organ. It has its own complaints. But before that, we had to look into the pituitary hormones and hypophysis. We can see that it always, like a catalyst, it may produce trophic hormones. Trophic hormones mean TSH. One of the hormone of pituitary gland is TSH. Whenever TSH is produced in the hypophysis, it may affect the thyroid gland. If it is, if the condition is less, if the thyroid hormones are not properly produced, then TSH will increase. THS will regulate. And THS will make, like a catalyst, it may produce more and more T3 and T4. That is the processing of, that is a process we can see in TSH production. So whenever some persons are thinking that TSH, why this TSH is high and high? Because thyroid gland is not performing well. That is why TSH is more producing, and the other hormones will come normal. Then we can go through one by one. Anxiety or depression, diabetes, hair loss, high blood pressure, irregular menstrual periods, unexpected breast milk production, low energy or low sex drive, standard growth or unusual growth spurts. Anxiety and depression. We have the first medicine. What? Aconite. Aconite. We know that what are the symptoms we can see in aconite. Aconite mind. Great fear, anxiety, and worry accompany every element. However, trivial. Small things, very small things may produce problems. Some people, some individuals, we can see that big problems, but they don't care it. But here, it's trivial, very small thing may annoy her very much. Another thing, Delirium is characterized by unhappiness, worry, fear, raving, rarely unconsciousness. Even unconsciousness may cause if hearing something. We know that whenever there is some depression in the business or in his homely problems or domestic problems, that time he may be upset. Now, what is happening here? There is only one way. They have to overcome this, they will suicide. If yesterday or day before yesterday, one heard that, we know that in newspaper, on news came, that one person, a 79-year person, killed his whole family, his children, his son and his wife and his both children, by firing inside in a home. And they tried to escape in the bathroom. That time he threw petrol-filled bottles inside it and burnt the 4 family members of his son and his grandchildren. How? Somebody are making problem solving by this way. They will kill others. Somebody will destroy themselves. They will suicide. They will make suicide. I heard one word on Solomon said, I have also learned why people work so hard to succeed. It is because they envy their neighbors. That is jealousy. Even if a single person, he will work throughout the day and night. He don't know. If he has the whole world, he will work hard. What? For seeing the others, he will compare with the others that I don't have these other things. That is the main reason for even he is single, even he is widow, he is a single man. That time he will work hard with cannot even, he can occupy the things. So that is the reason why depression is coming. Whenever seeing others, stress. Why this stress? We know that we want little. 3 times we should eat and have a shelter and have a vehicle. These are the main things. Then other things are also with it. But we are working hard because we are seeing other people and we are comparing with other people and always working and working. It may produce stress. The stress will produce diabetes. How? Then hair loss. Early hair loss. Because temperature will rise. Each and every time our temperature will rise and our hair will go its own way. Then other high blood pressure. These are the symptoms of pituitary gland. We are agitating the pituitary gland. We know that Hahnemann says that what he says, the derangement of vital force, how it is deranging. We should think about it. We ourselves, with our mind, ourselves, we are making derangement in our whole body. We have a spirit. The spirit should be pure and clean. Otherwise, it will be affected by evil things. Whenever evil things are coming, there is envy, jealousy. We just see, I saw many people having mental disorders. The basic reason is jealousy. If a child having jealousy, we should very much careful to try to avoid it from his condition. Then now high blood pressure, irregular menstrual period. We know that suppressed menstrual problems. There are so many medicines we have so many medicines having suppressed menstrual period due to any shock, anger, anything like that. Another thing, unexpected breast milk production. This is another condition in the pituitary, hormonal imbalance. Prolactin production in child, even in children, small children taking more hormonal medicines and hormonal chickens and everything, meat and everything. If they are taking more, it may produce unexpectedly the growth will, from very childhood, they may have a higher growth and hormonal imbalance will be there. The other one is low sex energy, low energy or low sex drive. This is another thing. Standard growth or unusual growth spurts, growth problems. Then let us go to the other. Acromegaly. This is one of the main reason. There is the production. There is any irregularity in the production of pituitary gland. There will be acromegaly symptoms. Symptoms, let us go to the symptoms. Enlarged hands and feet. Enlarged facial features, including the facial bones, lips, nose, and tongue. Cause oily thickened skin. Oily thickened skin. We know that natamor having oily thickened skin. There are many medicines having oily thickened skin. Natamor is on among them. And Tuja is on among them. Excessive sweating and body odor. Arsenic alba, calcareous carb. These are the medicines we are using in excessive sweating and body odor. This is one of the symptom of acromegaly. We don't think that everybody have acromegaly, but I just showing that if the production is not normal, then these are the symptoms. Small outgrowths of skin tissue, that is skin tags. This is one of the main reasons of skin tags. Normally, in many books, I did not read this symptom. That is why I showed it in red color, skin tags. I asked many people that there is any medicine for skin tags, but nobody given me a satisfactory reply. Then fatigue and joint muscle weakness, pain and limited joint mobility. These are the symptoms of acromegaly. Let us see a person. He is a acromegaly, pituitary, this headache symptoms, acromegaly symptoms, supraorbital bulging, head bulge. See this here, man's hand, carpal tunnel syndrome. We know that numbness and pain of the fingers, many people having these symptoms. Carpal tunnel syndrome. There's only, they are saying in allopathic medicine, they are saying that only operation will help. But we have many medicines. We just make the medicines and we can apply some arnica, restox oil and everything. And spigelia are a good medicine. Cactus, carbovage, arsenic alba, China, Adonis verse. These are the medicines we can use in carpal tunnel syndrome. And rub and massage is very nice. And we can, I had many cases, so many cases came to my clinic and I have treated with medicines. Our medicines will help a lot. Otherwise, they will do, even they do operations, then next time it may come. That is another thing. Vision defect may cause features, face, this type of face we can see. In our lifetime, many people they have thyroid hypertrophy, skin tags, galactorrhea, increased perspiration, hypertension, splenomegaly, polyps. Polyps, we may know most of the polyps are inside our nose. Sometimes we may be misled that it is asthma because they are difficulty in breathing. Then if we remove that polyp of the nose, that problem will be over. Because if there is a polyp inside the nose, it may reduce the oxygenation intake. Oxygenation intake, there will be percentage of oxygenation will be lost. That time we may have these type of symptoms, having general weakness, general weakness and everything. We know that low spirits. What is the medicine for low spirit? Please move a lip. Please move lip. Then I can hear. China, camphor, veratrum viride, veratrum alp, and these are the medicines for oxygenation for carbovegetabilis and gelsemium, low spirits. Nephromegaly, just see hepatomegaly, nephromegaly, cardiomegaly, splenomegaly, enlarged colons, enlarged hands, osteoarthritis. These are the symptoms seen in acromegaly. One person, we can see that gigantism. This is another condition of overproduction of what? Pituitary hormones. These are normal people. This one is a big one, giants. Is acromegaly hyper or hypo? That is a question. Acromegaly and gigantism are disorders of the abnormal excess secretion of growth hormone. Gigantism occurs when growth hormone hypersecretion occurs before the fusion of the long bones epiphysis and is characterized by tall stature. It should be noted. When it is happened, gigantism occurs when growth hormone hypersecretion occurs before the fusion of the long bone epiphysis and is characterized by tall stature. This is not after the birth. This is during the time. Gigantism occurs when growth hormone hypersecretion occurs before the fusion of the long bone epiphysis. That is, we should note it. Let us go to what type of hormone is adrenocorticotropic peptide hormone. Another on hormone of pituitary gland, adrenocorticotropic hormone, ACTH, otherwise call it as ACTH, is a 39 amino acid peptide hormone produced by cells of the anterior pituitary gland and carried by the peripheral circulation to its effector organ, the adrenal cortex, where it stimulates the synthesis and secretion of glucocorticoids. Here, we can see that Cushing's syndrome. Cushing's syndrome can be by overuse of cortical medication as seen in the treatment of chronic asthma or rheumatoid arthritis. This is in disease conditions, they are using more cortical medication to get a relief. But this may produce Cushing's syndrome. Excess production of cortisol from the tumor in the adrenal gland. This is natural disease. This is natural disease. The other one is a human-made disease.
In presentation.
Okay.
Bottom, there is
a problem. I made Just a minute.
Okay.
Okay. Okay, can you see?
Yes, yes.
Okay. Ayo. I made. Ayo.
Endocrine, you again open that file.
Just a minute.
Endocrinology. Again, technology upsets us.
Okay, can you see?
Yes, yes, right.
Cushing syndrome, because I have a problem. Cushing syndrome. Cushing syndrome can be caused by overuse. That I told you. This is a condition. We know that two adrenal glands. This is the superior part of the left and right kidney, adrenal right and left adrenal gland. It's a small gland. Small gland makes steroid hormones, adrenaline or noradrenaline. These hormones help control heart rate, blood pressure, and other important body functions. There are two adrenal glands, one on each side of the kidney, also called suprarenal glands. Person. This is another person. This is another person. Three type of persons. We may say that Katrikil Kali Molachu in Malayalam. Small legs and big body. Here, hunchback symptoms of Cushing syndrome. Person having this hunchback, having this thyroid hormone problem, and that time we may also can also be seen. Symptoms of Cushing syndrome. Moon face. You know, everybody. I think that everybody know what is the size, what the shape of moon, isn't it? Shape. Moon symptoms. Moon face, buffalo hump. Moon. This is moon. This is buffalo. Then muscle wasting, thin extremities. What Katrikale Kalamolacha, that is brinjal, like the legs, small legs and a brinjal in having two legs. A brinjal having two legs. That is what weight gain, obesity, easy bruising. We can see that easy bruising, sore feeling, arnica, other symptoms, sore, bruised feeling, and baptisia, skin and bone thinning. That is why it is the shapeless will happen. The crown formation. A round one, some old people having this round neck. A round leg. Then skin, bone and thin, libido, menstrual hair. We know that in girls having hair growth, over hair growth on, and these are all adrenal tumor. These are the conditions. Background set and hypocortisol, endogenous, exogenous source. Just a minute. I have to attend the call. Hello. I am in a meeting. After 9 o'clock, I shall come. Thank you.
Yes, you are muted. Please unmute, Dr. Hubert. You are muted. Please unmute, Dr. Hubert. Yeah, right.
We can see that depression, anxiety, irritability, loss of emotional control, cognitive difficulties. What is cognitive difficulty? We cannot understand. We can see the things, but we cannot understand. We cannot see. Loss of emotional control, cognitive difficulties, decreased libido, vascular new. Just a minute. I have.
Yes.
New worsened high blood pressure, bones, increased risk of fractures. This is one of the reasons for adrenal corticoid.
Some problems with your voice, Dr. Hubert.
Problem. Okay, just a minute. Shall I go?
Yes, right now it's okay.
Okay. Now, okay.
Yeah.
Reproductive problems in females, irregular or absent menstrual periods, dysfunction. The thing here, weight gain, overweight gain, glucose intolerance that is seen in children. Headache, moon face, buffalo hump, muscular weakness, skin thinning, thinning of skin. We should give it to the, so we should make, we should give some medicine for this skin. What are skin thinning for our politicians? If they take some, we have give some cortisone, then the problem will be over. Fragility, you know, acne. What is the medicine for acne? Acne. Pimples. Normally we call it as acne or pimples. Medicines for Kali brome. One of the medicine, Kali brome. Sulfur can be given intermittently. I used arnica, very nice. Arnica will help a lot. Excessive hairness, hirsutism, and striae of abdomen. So normally it may seen in after delivery, but here sometimes it may seen in early life. Hormones of adrenal gland. These are the hormones of adrenal gland. Estrogen, androgen, adrenaline, noradrenaline, cortisol. What does cortisol do to your body? Cortisol, the primary stress hormone. These are the stress hormones. Hormone increases sugars in the bloodstream, enhances your brain's use of glucose and increases the availability of substances that repair tissues. Cortisol also curbs functions that would be non-essential or harmful in a fight or flight situation. Whenever we are thinking about sugar, always they will think that, oh, this is an enemy for human body. Don't think so. Glucose, we need it. If glucose is gone down, that means we may die at any time. That is what is happening in whenever they are taking more and more insulin without checking the insulin content, how much insulin they are taking, that sudden coma stages and everything are happening because of insulin intake. The sugar will going down. But we know that 60% of our energy should be needed for our brain. Then only brain will work. That much energy is needed. Here, hormone increases sugars in the bloodstream, enhances your brain's use of glucose, and galactose is also an important sugar needed for our brain function, and increase the availability of substance that repair tissues. Tissues repair is very much needed. That is why if the cortisol production is high, we should sleep a lot. Then adrenal gland secretes hormones which help regulate stress and metabolism and supplement other glands. What are the symptoms of high cortisol level? General signs and symptoms of too much cortisol include weight gain, mostly around the midsection of upper back, big buttock, and big stomach. That is the reason, one of the reasons for cortisol production. Weight gain and rounding of face, acne, thinning skin, easy bruising, flushed face, slowed healing, muscle weakness. Okay, these are all we said. Another one reason for cortisol production. We should always use homeopathic medicine. Why this? I am elaborating this type of physiological and pathological symptoms. I am saying that we have a few medicines: Lycopodium, Nexomica, China, acid force, Beretta-carb, the other medicines I told in the earlier part. We have cortisone. There is medicine for cortisone. These are the medicines can be used for to reduce this type of symptoms if it is making our problems more. Pulsatilla. Pulsatilla is one of the main medicine, and iodine. Iodine in higher potencies. Higher potencies and lower potencies we can use for to clear these symptoms, increase blood sugar, suppressed immune system. That is another thing. Cortisol produce, higher production of cortisol produce immune system problems. Immunity will be reduced because we know that if the sugar is high, then our immunity will be low. There is chances for tuberculosis infections and everywhere. Tuberculosis and diabetes are hand in hand. It may travel hand in hand. Decrease serotonin. Serotonin, we know that it is giving a good happiness to our mind. It will reduce, cortisol will reduce. If the production of cortisol will be more, the serotonin will be decreased and you will not get good sleep. For sleep, I use two medicines which is very helpful: hyoscyamus and Nexomica in higher potencies. Use within a few days, within a day, you will be on get normal sleep. A person came to a person. I am treating a person. Last time, he has some sleeplessness, and they given some neurological medicines. That time, deep sleep, and he cannot rise from the bed to even go to the latrine. So he may pass stool and urine in the bed. After taking Nexomica and hyoscyamus in higher potencies, he got relief within 1 or 2 days. I think that the next day he got it. What causes cortisol to rise? Cortisol to rise. As your body, sometimes we may see that some people may have higher, very BP low, and this condition, as your body perceives stress, your adrenal glands make and release the hormones cortisol into your bloodstream, often called the stress hormone. Cortisol causes an increase in your heart rate and blood pressure. It is your natural fight and flight response that has kept humans alive for thousands of years. we can use in hypothyroidism. That time the person may have this type of cold sweat and everything, fatigue and what, doctor? This time is over. Pardon? Okay. Then these are the organs we have seen it. What are the symptoms of low cortisol level?
I think you can continue 3 to 4 minutes, then we can have a discussion.
Okay. Low levels of cortisol can cause weakness, fatigue, and low blood pressure. You may have more symptoms if you have untreated Addison's disease or damaged adrenal glands due to the severe stress, such as from a car accident or an infection. These symptoms include sudden dizziness, vomiting, and even loss of consciousness. I remember one thing. Our previous former Chief Minister, Sri K. Karnagaran, had a very an accident. He had an accident near my home. And he was sent to America and treated. After coming here, his shape was gone. His vertebra was broken, severely broken. Most of them are said in his old age he will not recover. But he came back and immediately he started his work very speed. Even before that, he was very speed and he is hosting a flag. That time I was really embarrassed because how he got this type of willpower. Willpower will give a lot of things. Stress will produce weakness, but willpower will give you strength. Cortisol, low levels of cortisol can cause weakness, fatigue, and low blood pressure. You may have more symptoms if you have untreated Addison's disease or damaged adrenal glands due to severe stress, such as from a car accident or an infection. These symptoms include sudden dizziness, vomiting, and even loss of consciousness. Some people, whenever coming to your clinic, they will have belching. Each and every time they will belching, and it may be due to, if you are going to take his BP, he will belch, and gastric problems will be there. It is a condition of panic disorder. That is a patient. Seeing that patient, we can see that he is a panic patient. We should give medicine first for his reduce the fear and anxiety. Then only most of the symptoms will be more. Then I think that this is the time for our discussions. You can ask. If I know anything, I shall say. Otherwise, please pardon me. Thank you very much.
Yes, Sridan from Jordan is a regular participant and an enthusiastic person too. Yes, Mahmoud Sridan, please unmute. Yes.
Thank you, sir. Thank you, sir. Just I have one basic question. What causes the pituitary malfunction? And what are the reasons, or the most probable reasons that affect the pituitary in order to get its defects?
Yeah, there is one benign tumor may cause. That is benign tumor. It is not dangerous, but it may produce and it may press the pituitary gland, and the production will be less. Yeah, it may. Sometimes it may, throughout the life they may have. They suggested that the allopathic doctors have suggested that to operate it. But even though it is operated itself, it may produce each and every time. It may recur.
Does it have any relation to oxidative stress?
Pardon?
And does it have anything to do with oxidative stress? This is the elevation of free radicals in the body. And the free radicals are the incomplete oxygen atoms that.
Do you know that?
Radicals, yes.
Yes. Okay. Okay.
Thank you. Thank you, sir. Shukran.
There is we know that each and every organ having there is a blood circulation and neural circulation and nerves support, and everything is there. Even it is in the very small, even in the each and every cell having this type of nerve supply, blood coming and out supply. But this is an organ. The organ having its own blood supply. If the blood supply is reduced, the oxygenation is deficit, then it may produce its own symptoms. It may produce.
Thank you.
That is one of the reason. We know that if it is inside the brain, base of the brain. So there is any pressure of the pituitary gland itself will make so many symptoms in the body. Even blindness may have.
Will stress do something for the pituitary?
We have medicines.
The psychostress, for example.
Okay. We can do. Because the hypertrophy of the pituitary gland, we have medicines. So there are so many medicines we have. I think that calcareocarb, I used calcareocarb and successfully it was cleared most of the symptoms. We may always, most of the time, I may give much importance to this hormonal imbalance in the body.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you, sir.
It is my doubt that, certain antibodies are created in our bloodstream, and it is acting against the producing of the hormone. It's like TPO. Then what is the cause for that? Do you know it?
There is a backward feedback mechanism is there. If the production is normal, our body have a normal production and normal thing. If the production is more against the hormone, wherever it is produced, it may react. Feedback mechanism, it may call this a feedback mechanism. If it is not required, then the normalcy body will make the normalcy. On hormone will stop the production of the other hormone.
Okay.